Has someone you love started showing subtle but concerning changes over the past year? A little less energy, a little more silence. If you're over 66 or love someone who is, this might be the most important video you watch today. The journey of aging is both profound and delicate. Each grey hair earned, each line upon the face, they tell stories of lives well lived, of wisdom gathered through decades. Yet within this natural process lies another reality many find difficult to discuss: the gradual transitions that signal our final chapters. Today, we're creating a space for this conversation, not from a place of fear, but from deep compassion and respect. Because understanding brings peace, knowledge brings readiness, and awareness brings the precious gift of meaningful time together when it matters most. We'll explore the 6 most common reasons that account for nearly 99% of deaths after age 66. We'll discuss their early warning signs, many frequently overlooked or dismissed as just getting older. We'll share practical wisdom on when to seek medical help, how to have difficult conversations, and most importantly, how to be truly present during these sacred transitions. Whether you're watching for yourself, a parent, spouse, or friend, this knowledge is a form of love, a way of honoring the natural cycle of life with dignity and respect. Most people imagine death as a sudden event, a heart that stops, a final breath without warning. But in truth, most of us don't just slip away. The body gives us clues, gentle, sometimes barely noticeable signs that life is winding down. Recognizing these signs isn't about fear, it's about love, about presence, about knowing when to lean in more, listen deeper, and hold someone's hand just a little longer. Common misconceptions about aging and end of life. Myth. Number 1. Getting old means losing quality of life. Many seniors enjoy rich, fulfilling lives well into their 80s and 90s. What's important is distinguishing between normal aging and actual health concerns. Fatigue from a busy day is normal. Becoming exhausted from walking to the mailbox is not. Forgetting reading glasses is normal. Forgetting how to get home is not. Myth. Number 2. Nothing can be done anyway, so why worry? Many conditions, even serious ones, can be managed effectively when caught early. Additionally, recognizing these signs gives everyone precious time to address practical matters, have meaningful conversations, and simply be together. Myth number 3. Talking about death is morbid. In many traditional cultures, death is viewed as a natural transition, not a fearful taboo. Research shows that open, compassionate conversations about end-of-life wishes actually reduce anxiety and depression for both seniors and families. Myth number 4. Only doctors can recognize these signs. Those closest to an elderly person, family, friends, caregivers, are often first to notice subtle changes. Your observations are valid and valuable. You know their normal patterns, energy levels, and usual joy. Myth number 5. Decline is always rapid and obvious. For most elderly individuals, the journey is gradual, rarely a sudden cliff, more often a gentle slope with subtle changes over months or years. Learning to recognize these early shifts gives everyone the gift of time. The truth is, understanding these signs isn't about anticipating loss. It's about maximizing life. The heart, the body's engine, doesn't usually just stop, it slows. A person might get winded walking across a room or need more naps than before. You might notice swelling in their ankles or a sudden drop in stamina. These aren't just signs of aging, they can be quiet cries from a heart that's struggling. The heart beats approximately 100,000 times each day, pumping nearly 2,000 gallons of blood. But after decades of service, changes occur. Blood vessels become less flexible, heart valves stiffen, and the heart muscle can weaken. Early warning signs include unusual fatigue, not just being tired, but exhaustion that seems disproportionate. Shortness of breath, especially when lying flat or during activities that never caused difficulties before. Swelling, particularly in feet, ankles, and legs, worse in the evening. Dizziness or lightheadedness, especially when standing up. Changes in skin color, particularly a bluish tint to lips or nail beds. Persistent cough, especially one that worsens when lying down. When the heart begins to struggle, emotional changes often follow. Increased anxiety about going places, frustration at decreased stamina, withdrawal from activities once enjoyed, new hesitancy to make future plans, and more reflective conversations about the past. When should you seek medical evaluation? Chest pain, pressure, or discomfort? Severe shortness of breath that comes suddenly, fainting or severe dizziness, rapid or irregular heartbeat with weakness, sudden swelling or weight gain. Practical ways to support cardiovascular health include gentle exercise as advised by their doctor, heart-healthy meals that limit sodium, medication management systems, and regular monitoring of blood pressure and weight. Beyond medical interventions, your presence matters profoundly through sitting quietly together without filling silence, gentle hand massage to improve circulation, reading aloud favorite books or poetry, creating playlists of meaningful music, and reminiscing about happy memories. Have they started sleeping propped up on more pillows, or pausing mid-sentence to catch their breath? Shortness of breath isn't always loud, it can be subtle, but it's often serious. Lung diseases like COPD or complications from past smoking can creep in quietly. Watch the chest rise and fall. Is it labored? Are they coughing more often? The average person takes about 20,000 breaths per day. For seniors with respiratory conditions, each breath can require conscious effort. Common respiratory conditions include chronic obstructive pulmonary disease, COPD, pneumonia. The elderly are particularly vulnerable. Pulmonary fibrosis, scarring of lung tissue, sleep apnea, more common with age, and pulmonary embolism, blood clots that travel to lungs. Subtle early signs include changes in breathing patterns, more rapid shallow breathing, positional changes, needing to sit upright to breathe comfortably, color changes, especially around lips and nail beds, voice changes, becoming softer, requiring more breaths between phrases, activity limitations, gradually doing less to avoid breathlessness, sleep disturbances, waking gasping or needing more pillows. Few sensations create more primal anxiety than not getting enough air. Your loved one may experience fear of being alone, especially at night, anxiety about going places without easy access to help, and frustration at limitations their breathing imposes. Creating a supportive environment involves maintaining good air quality, minimizing dust and irritants, positioning furniture to allow for proper breathing support, keeping air appropriately humidified, and arranging living spaces to minimize stares. When should you call for medical help? Sudden increase in breathing difficulty, blue lips or fingertips, extreme fatigue or inability to speak in full sentences, confusion or disorientation, and chest pain accompanying breathing problems. Where did I put my keys? Is normal. But when someone forgets names, dates, or starts getting lost on familiar streets, that's different. The human brain contains roughly 86 billion neurons. While some changes occur with age, processing speed may slow, multitasking becomes difficult. Significant memory loss or confusion is never simply getting old. Early signs of cognitive changes include repeating questions or stories noticeably more often, difficulty finding words, particularly names of familiar people or objects, becoming lost in familiar places, even momentarily in their own neighborhood, problems with abstract thinking, difficulty with numbers or managing finances, misplacing items in unusual places like finding car keys in the refrigerator, changes in judgment, making decisions that seem out of character, withdrawal from social activities, especially if previously engaged, and mood or personality shifts, increased anxiety, suspicion, or inappropriate behaviors. Common causes include Alzheimer's disease, progressive memory loss, vascular dementia, caused by reduced blood flow to the brain, Lewy body dementia, with hallucinations and physical symptoms, medication side effects, particularly from sedatives or multiple medications and infections. Urinary tract infections can cause sudden confusion in the elderly. For many elders, cognitive decline brings profound emotional challenges, awareness of their own changes, causing fear and grief, embarrassment leading to social withdrawal, frustration when unable to communicate effectively, and fear of becoming a burden. Creating a supportive environment involves maintaining consistent routines to provide security, simplifying living space to reduce confusion, using clear labels, notes, and reminders, reducing background noise during conversations, allowing extra time for responses and tasks, creating photo albums with labeled pictures, and playing familiar music, which often remains accessible when words fail. Practical communication approaches include avoiding correcting mistakes that don't matter, using simple, direct sentences without talking down, asking one question at a time and waiting patiently, connecting through touch, music, and sensory experiences, validating feelings rather than challenging faulty memories, and joining their reality rather than forcing your own. The liver, kidneys, pancreas, they don't send alarm bells when they begin to fail. But the body tells us in other ways: yellowing skin, swelling, nausea, or loss of appetite. You might hear them say, "I just don't feel right, but I can't explain it." Listen, take it seriously. A quiet complaint could mean much more than they know. Kidney decline signs, subtle swelling, particularly in ankles, feet, hands, changes in urination, including color, frequency, or nighttime trips. Fatigue that seems disproportionate. Itchy skin. Waste products can cause persistent itching, metallic taste, or food aversion. Liver stress signs, yellowing of skin or whites of eyes, bruising more easily, swelling in abdomen, fluid accumulation, unusual drowsiness, toxins affecting the brain, darkening urine, often described as tea-colored pancreatic issues, unexplained weight loss, abdominal pain that radiates to the back, floating, oily stools, from undigested fat, sudden onset or worsening of diabetes. When organ systems falter, the experience is often vague. Your loved one might express a sense of unwellness they can't specifically name, frustration at feeling tired without doing anything, or a loss of interest in food, creating comfort and dignity. Honor food preferences while adapting to changing needs. Ensure adequate hydration in appealing ways. Create restful environments. Find meaningful activities that accommodate changing energy levels. When to seek medical care. Yellow skin or eyes. Significant swelling of extremities or abdomen, confusion or extreme lethargy, severe abdominal pain, blood in vomit, stool, or urine. Even when medical interventions become limited, your presence remains powerful through honoring their body's changing needs without judgment, creating sensory comfort through soft textures, pleasant scents, gentle music, listening for unspoken emotions beneath physical complaints, and providing opportunities for life review and reflection.
7, 6, 5, 4, 3, 2, 1.
You'll never have the sacred stone.
Oh, this you crazy mother.
Cancer doesn't always scream. Sometimes it whispers. A strange weight loss, a sore that won't heal, a cough that lingers longer than it should. The elderly often mistake these signs for just getting old, but the body is wise. It always tries to tell the truth. More than 60% of cancer diagnoses occur in people over 65. The good news is many cancers grow more slowly in older bodies, allowing more time for intervention when caught early. Subtle signs that shouldn't be ignored. Unexplained weight loss, losing 10 pounds or more without trying, unusual fatigue, beyond normal tiredness, persistent pain, especially in one specific area over time, skin changes, new growths, sores that don't heal, changes in bowel or bladder habits, difficulty swallowing or persistent indigestion, unexplained bleeding from any body opening, common cancers in seniors, skin cancers including basal cell, squamous cell, and melanoma, breast and prostate cancers, colorectal cancer, often developing slowly over years, lung cancer. Symptoms often attributed to other respiratory issues. A cancer diagnosis brings complex emotions, but for seniors these feelings often have unique dimensions. Questioning whether treatment is worth it at their age, concern about being a burden, reflection on life lived and what truly matters now, and fear of losing independence more than fear of death. Treatment considerations for seniors. The importance of geriatric oncology specialists. Quality of life as a primary consideration. Balancing existing health conditions with cancer treatment. Honoring personal values about intervention levels. When to seek medical evaluation. Any warning signs persisting for more than 2 weeks. Symptoms that seem to be worsening. Changes that affect daily function. Being meaningfully present. Follow their lead on when to talk about illness and when to focus elsewhere. Respect their decisions about treatment. Create opportunities for joy and normal life amid medical realities. Honor their wisdom about their own body and experience. This one isn't physical, it's spiritual. They stop answering calls. They skip family dinners. They sit by the window more than they used to. Sometimes people know, on a soul level, that their time is nearing, and they begin to let go before their body does. Throughout human history, there has been recognition that as life nears completion, a natural withdrawal occurs. Indigenous cultures speak of elders beginning the journey home. This isn't depression, it's a profound transition deserving respect. Signs of spiritual preparation: decreased interest in news and world events, reduced desire for social gatherings, increased reflection and reminiscence, changes in sleep patterns, more time resting, loss of interest in material possessions. Speaking of departed loved ones as if present, using journey metaphors, talking about going home or being ready, seeking reconciliation or expressing forgiveness, expressing satisfaction with life lived. It's been enough. This natural withdrawal often triggers anxiety in family who mistake it for depression or giving up. But hospice workers have observed this pattern across cultures and beliefs. It appears to be a natural preparation of consciousness for transition, creating sacred space. Honor. Changing social needs without taking it personally. Create quiet, peaceful environments. Sit in companionable silence without forcing conversation. Listen deeply when they choose to speak. Be comfortable with metaphorical language. Honor spiritual practices and beliefs. Perhaps the greatest gift we can offer is simply to witness this transition with reverence by being fully present without trying to change or fix, accepting their journey even when it triggers our fears, creating protection from well-meaning but intrusive interventions, recognizing they are doing important inner work that may require solitude. No one should walk this path alone. Even the most dedicated caregiver needs support. Identify family, friends, and community resources who can help. Be specific about assistance needed: meals, transportation, companionship. Consider creating an online care calendar. Connect with caregiver support groups. Remember that accepting help honors both you and your loved one. Navigating the medical system. Request a geriatric assessment for complex health issues. Bring written questions to appointments. Consider recording discussions for later reference. Ask about medication reviews to prevent harmful interactions. Explore palliative care options, available at any stage. Home safety considerations. Remove trip hazards like loose rugs. Install grab bars in bathrooms. Improve lighting, especially in hallways. Consider first-floor living arrangements. Add nightlights for safer navigation. Having difficult conversations. Choose a calm, private time without distractions. Start with open questions about their wishes. Listen more than you speak. Address one topic at a time. Recognize these conversations often happen in stages. Caregiver self-care. Recognize signs of caregiver stress, exhaustion, irritability. Schedule regular respite breaks. Maintain your own medical appointments. Find at least one person you can be completely honest with. Set realistic expectations and boundaries. Remember that self-care isn't selfish, it's essential. Every elder carries a library of experiences, wisdom, and memories. One of the most meaningful gifts is to help preserve these stories, not just for historical record, but as a way of honoring their journey. Research shows life review provides significant benefits: increased sense of meaning and purpose, reduced depression and anxiety, enhanced sense of identity, opportunity to resolve lingering regrets, sharing wisdom with younger generations, simple ways to capture stories. Set aside regular time for reminiscence. Use photos or objects to spark memories. Ask open-ended questions about different life periods. Record audio or video of storytelling. Create memory books with photos and stories. Meaningful questions to ask. What's one of your earliest memories? Who were the most influential people in your life? What historical events do you remember most vividly? What wisdom would you most want to pass down? Stories live in many forms beyond verbal narratives. Cooking together and documenting family recipes, recording musical performances or favorite songs, creating art projects that reflect important memories, writing letters to younger family members, teaching skills to younger generations. Even with cognitive decline, stories remain important. Focus on emotional memories, which often remain intact longer. Use music, scents, and tastes to evoke memories. Honor fragments of stories with the same respect as complete narratives. Create opportunities for expression through art and music. This journey, whether caring for someone now, preparing for future changes, or processing a path already walked, is both universal and deeply personal. While each experience is unique, shared wisdom creates a map for all of us. Consider starting a conversation circle in your community for caregivers, creating memory books with elderly loved ones while they can share stories, exploring advanced care planning conversations, learning about palliative care options before crisis moments. The way we care for our elders reflects our deepest values. By recognizing these transitions with compassion rather than fear, we transform not just the experience of aging loved ones, but our own relationship with mortality. As Ram Dass beautifully expressed, we're all just walking each other home. May this conversation remind us that awareness isn't about fearfully watching for decline. It's about being fully present for each precious moment we're given together.